Okay, team, let's have a look at wee Simeon. Nurses and doctors, they're kind of the service industry. They're about looking after people. You know what I'm saying? To get them to boo, I think is a pretty impressive statement. I guess I will say, to his credit, unlike other ministers of the Crown, he went along to a conference full of nurses and doctors. Maybe to his credit, or maybe that just shows how arrogant he actually is and believes his shit don't stink. Apparently doctors, nurses, for striking for 4 hours makes them unethical. They're crossing an ethical line.
To the day's other news now, and Health Minister Simeon Brown has urged senior doctors not to take part in next week's mega strike, saying it crosses an ethical line. But their union says striking is the only way to get the government's attention as they try to care for patients in an overstretched health system. Senior political reporter Bridie Whitten has the story.
Health Minister Simeon Brown facing off with senior doctors at their annual conference over their decision to strike next week.
But when a union chooses strike action that forces thousands of operations and appointments to be cancelled, in my view, it crosses an ethical line.
Prompting laughs on his assessment of the health system.
The union strike action is coming at a time when progress is being made, when our health system is finally turning a corner, but also during the time...
And on pay.
That's devastating.
Savage.
That is devastating. I wonder if these ministers, you get those people who are surrounded by other echo chamber yes men. I wonder if he actually believes that. Like, I wonder if he thinks what he's saying is accurate and true. That's almost scarier than someone who's just getting up and knowing what they're saying is bullshit. I wonder what wee Simeon actually thinks. Like, it would be really interesting if that was an interview to go, point of order, sir, explain to us the progress that's being made. Give us half a dozen examples and see what he comes with. But no, someone in the chat, look at his face. Yep, he wasn't quite expecting that to happen.
During the time...
And on pay.
The average total remuneration for a senior doctor is $343,505, including overtime and allowances, and this does not include any remuneration from private practice.
A joke from the crowd about the flow of Kiwi doctors across the ditch.
Can you confirm that the New Zealand governments will continue to invest significant public funds to pay for the training of New Zealand doctors so that they may leave New Zealand and supplement our medical skills in our Australian hospitals?
Before Brown put jokes aside with a challenge for their union.
Stop playing politics with patients' lives and let's actually resolve these issues. And the first action they could do to show that they're willing to do that is to call off next week's strike. More
than 100,000 teachers and healthcare workers are due to walk off the job next Thursday as part of a mega strike. Health New Zealand says it will postpone 900 procedures.
Hang on. Simeon said thousands.
Simeon also said they were putting their lives at risk.
I think
so
Simeon also
that they were going to put 900,000 people in a boat and push it out into the island.
Simeon also said he's 6'2". I don't know if I can believe any of these things he's saying. No, but Simeon said in that last thing, I'm not going to scroll, he said thousands. Health New Zealand, te whata ora, please, is saying 900. Come on, party of numbers, party of business. That's how they're going to come back and say the ferries cost less because they're going to cost $6 billion and they're going to say it's $2 billion because they're that far off every time as a proportion of the truth versus what they say.
Nearly 1,400 first specialist appointments. But this Palmerston North emergency consultant says ethical dilemmas are a daily reality.
Ethical line is explored every single day and people are denied care every single day. A strike is just one day where we bring it to everybody else's attention.
Documents from Health New Zealand show strike days do have a big impact. The September strike saw 1,400 fewer admissions and 3,000 fewer follow-ups each day.
But senior doctors say they do not take the decision lightly.
We've taken strike action because we really believe the health system's in peril.
Striking because they say it's their last resort.
And then there's that question that we will always come back to, which is quite simply the understaffing of our hospitals. Does that put more lives at risk than a 4-hour strike? So 364 days and 20 hours, does that understaffing across all of that put lives more at risk than understaffing, overworked, exhausted medical staff? I would suggest yes, Mr. Who's Playing Politics Now. Chewie?
Yeah, absolutely. Look, I am blown away that he tried that average remuneration line in the room with them.
Yep.
Like, I think he's lucky that it was laughter and not cutlery coming his way. Like, damn.
I did. Sorry, go, bro.
I'm just stunned that like with all of these strike actions, Judith Collins done it, Simeon Brown's done it, that they're just sticking to this line of like, if we tell New Zealanders that they get far more money than you guys do, then that will make them angry with them.
Yeah.
When I think that your average New Zealander is going to go, oh, yeah, doctor makes more money than me. Yeah, that makes sense.
And that probably speaks to, as stupid as he wasn't speaking to the people in the room.
Mm.
He was speaking to the cameras who were going to put it into the living rooms of New Zealand. What he wasn't expecting was what he was saying to the cameras to be made look ridiculous by senior doctors laughing. He didn't have that as a part of his equation. He's going to go, they're not going to like what I'm saying, but the people at home will get the message. He didn't go, they're going to like what I'm saying and they're going to ruin my message by laughing in my face, killing any kind of impact I'm going to have on those people in their living room. So he didn't account for that.
I think it's also very, very brave. Brave wee Simeon charging into battle with his wooden shield and his little wooden sword. Saying how doctors aren't ethical.
Yeah.
When we know that that's a big part of their job, but not only that, it's a big part of their training. They study ethics. They can produce grades on them passing their medical ethics course. Should we ask to see if Simeon Brown has a similar qualification on ethics? Is it I'll show you yours if you'll show me mine thing?
So the doctors are saying they can prove they're professionally ethical, documented.
Rated.
Yeah.
Rated.
Yeah.
Analysed.
Yeah.
Peer-reviewed, ethical.
When you just said grabbing his wooden shield, it just made me think of this.
It's adorable, isn't it? It's adorable. It's the same. Where'd you get this picture of Simeon?
Yeah, Simeon with a shield, like a South Park character. There's probably a way of doing that. And he's this big. You know the joke they always make on 8 out of 10 Cats does Countdown when they're making product and stuff for people, and John... what's his surname? John. I was going to say John Oliver. No, the comedian John. He's very short. They always deliver him a little tiny version of the thing they give to everybody else. So you could do the same with Simeon. Yeah, look, I do like thinking about John Richardson. Thank you, Solar's Cream. I do like to think about how did that message get to the podium? Like, where did it come from? How was it decided? What were they thinking when they mentioned those two things? Interesting that the 3 News report, I was going to play one, but that was the 3, I think, didn't have the booing. The 1 News had the booing when he said it, but 3 News cut that out. So that's interesting.
Why would you cut that?
Yeah, I don't know. Interesting editorial decision. But I'd like to understand like to speak to the people who made that decision. How did this speech then get to the podium? Not saying that they shouldn't have used it, but what was the rationale? What were you thinking? Because, yeah, Not smart. Not smart. Didn't work. So whatever your plan, unless your plan was to be humiliated and look like a fool, okay, fair, that worked. But if it was anything other than that, didn't work.
Great success. Yeah, so this mega strike's what, next Thursday next week?
I think it's Thursday, yeah.
100,000 people taking strike action. There's never been something like this in my lifetime.
Yeah, we're talking to Fleur Fitzsimons. Yes, right. Fitzsimons, when you were away, I think. Were you back for that? Anyway, about the upcoming mega strike, it was like, I don't think we've ever had a general strike. Correct me if I'm wrong.
We can't. Legally,
because of the police.
There was one, I think 1979 was the last one. Right. And then they changed the law that basically is, you know how like a union would go on strike and then another union would have a sympathy strike? Yeah. So you might have the wharfies and then the freezing workers and then the railway union, you know, and it just spirals from there. It just absolutely shuts everything down. So they actually changed the law that you can't sympathy strike. You can only legally strike if it's part of your pay negotiation. So they took away the ability for a general strike. And it has taken this government half of their term, a little over half of their term, to piss off so many people that they've gone, well, we're going to have a bunch of different independent strikes all on the same day. That's how we're going to get around it.
Yep. As what Fleur was saying is, I mean, without making it as black and white as it sounds, but this is about as close to a general strike as we'll ever see. So, yeah. Pretty cool. I mean, not cool because they have to, but pretty cool that they're able to organise it.
It'd be great if they didn't have to. Yeah. But, I mean, in all the discussions, like we've seen Luxon come out, he clearly doesn't understand how unions go, how they work. Like he was talking about, he's getting his knickers all in a twist because the teachers union clearly didn't take the time to present the latest pay offer that was presented at the last minute to their members, and so clearly the members didn't have a chance to vote on it. The little thing that came out about that afterwards is the offer that they were presented was worse than one that they had already rejected. So why would the union take it to its members when its members have already said, no, it's not good enough?
I mean, you can think about it like from a different perspective. I want to buy Chewie's house and I offer Chewie $600K for his house and they decline that. And then I go, okay, let's offer him $550. Like, it's like, we're just not going to present it.
It's jump. Again, party of numbers. You know, it's a negotiation. Big business daddy should know how to do big business negotiations. That's what he's doing. You are trying to keep the workforce going and you're doing an offer that's not good enough. Like, it takes a lot for senior doctors to go on strike. Again, I can't really remember the last time that that's happened. And it's come out of real concern. The government wants to make it about money. Mm-hmm. It's the only thing that they mention. You know, here's how much the doctors and nurses and the teachers are paid. Yeah. Whereas you talk to any of these teachers and nurses and doctors, and they will tell you, no, pay is one part of it, but it is paying conditions. We are concerned about safety. We are concerned about the longevity of the public health system.
Oh, kia ora whānau. Have a small favour to ask you. On the bottom of the screen right now, there is a QR code. If you click on that QR code, it takes you to the New Zealand Podcast Awards, the nomination page for listener choice. If you would be so kind as to head to the listener choice page and perhaps think about nominating Big Hairy News for the Listener Choice Award. It's a great way you can support us. It's a great way that we can continue to get our name out there. And if you enjoy the content that we provide for you, maybe you would consider heading to nzpodcastawards.com/nominate or click on the QR code to nominate Big Hairy News. Thank you.